Audible?
Yes, sir.
Good morning. As outside, let me thank the organizers for giving this wonderful opportunity. I am well aware there are subsequent speakers.
Sir, you can take your time.
Who are all extraordinarily great with language, flow and ideas. To the best extent possible, I will try to do my best based on certain experiences what we have gone through. A journey of almost 45 years, what I can say. I used to be teased as Freud in the department when I joined CMC Vellore. I used to be called a sexologist because having some interest. But it was quite often used as a sarcastic comment rather than as a title. All said and done, the journey which I started has been a wonderful experience. And if somebody has to look into his life, reading, working on sex may be one of the best things that can happen to one's life. Instead of reading textbooks which are very boring, sex books are the subject topic of sexual medicine. So, at the beginning itself, what I can very boldly say is, this is something actually extremely good. Somebody was asking me, you are 70 years old, but you look young. I don't know how they interpret all these different things, but all said and done. What is the secret? So somebody has asked me. So I have told them that just thinking of sex keeps you young. That very fact can make your life a pleasant one, enjoyable, and for all practical purposes. I can quote my wife again and again in my presentation. She feels there is something crazy about you. I have a lot of traits which are there in life. She's supposed to have married me thinking that psychiatrists are easy to handle. That's what her friends have told. I can malleably modify him and a whole lot of things. Ultimately, she has given up. And one or two statements from her. My life was so nice and happy. Then I married you. So this is one statement. Another deadly statement what she makes is, if you really loved me, you should have married somebody else.
The first statement is true in my case also.
So the whole idea is, we are in some particular way, and actually the life has taken us in so many fashion. Coming to our own branch, I go with one principle. There are some very young people who have joined our fellowship program, diploma course, and they will ask us how to establish practice, how to go about. The first point what I can say is actually, every person you meet on this earth, they are sexual problem cases. It is only yesterday, today or tomorrow. That's all actually the difference. That means if you are trying to look at the clientele, everybody is your client, including Dr. Rao. And you want to know about me means you have to talk to my wife. In fact, Kinsey was one who started working on sexual medicine in a very big way, and the surveys and all, we are all well aware. There was an interview with his wife. She says, I don't know, this fellow started sex survey, but then subsequently I am not seeing him at all. You got the point? This is an extremely common problem with sexual medicine specialists. So if you ask my wife, possibly you will come across almost a similar version. All said and done, what I was trying to talk about, sex is everywhere. That's what I was actually trying to tell you. There are many examples I can give. See, this our car fellow, I started in the morning, and there was sex makers board in Pune on the way to this place.
Sex maker.
Sex makers. I told him just stop it like that, but it is actually specs makers. I was very happy because Kadakosla, they are arranged the program and always will be something very special in this particular road. It was actually specs makers, and I read it as sex makers. In our department, there was a program what we were trying to arrange, and there is a lady who is very efficient and organizes all the things. Is this masturbatory shop? I was wondering why she is talking about masturbation. Sexual medicine, we are comfortable, but all said and done, lady talking over the phone to somebody. Then I realized what she is telling is actually whether this is master bakery. So I was hearing it as masturbatory shop. What is this masturbatory shop? Where is this particular thing as? I still remember one lady who came and she wanted to join our department. An application she is supposed to fill up. She took a little bit of time, that pen was there, she fixed her hairdo, and after a few minutes later she left the application and went. I was trying to read, her name was there, age was there, the column sex. She had written 2 times per week. Now what I am trying to tell you, sex is everywhere. We don't even imagine that it's actually important.
We imagine, that is why it is everywhere.
So this is very, very common. When we are trying to talk about whole lot of things, even Sivarambal Nilima actually enjoys this particular joke. But,
Whole or whole?
I was traveling from Kolkata to Bangalore, late night flight, it was around 11:30. Any Bengalis in this group? Okay, na? Bengalis means very talkative Indians and all means Bengalis. They are very restless. In fact, one of the very characteristic feature you can see is lunchtime, their plate is literally fully packed, means most probably they are Bengalis. You may be a little exception, forget about it. There were 3 fellows in the front row, and this particular fellow pressing that button again and again to get the attraction of air hostess. A little while later she came. This fellow's English is also not good. This fellow telling, I am fingering and you are not coming. No, you are. I could imagine she might be actually, I need little more than fingering, but all said and done. The point what I am trying to convey is actually that this is extremely common, and it all depends on how we.
Most men relate to it.
In fact, that is one of the reasons. In fact, men believe that sex means it is nut and bolt phenomenon. That's why the terminology screwing has come. Fingering, all these type of terms are very, very common. And I always tell, whoever wants to do sexual medicine practice, they should get first comfortable about these terms. Be a little relaxed and detached. It actually serves the purpose. When we are practicing, in fact, the people present in so many ways. This is one of the extremely common problem, and we are all well aware. When we started our practice, young people coming and telling about so many things. One of the easy ways, all of you might be aware, if you're the engineering student, my engine is not working, my machine is in problem. We have this Mysore University botany, zoology. Sir, my antenna is not working. My mobile is not working. In fact, I was thinking mobile, there is some problem. There is problem with my brother. I was wondering where is the brother. The younger brother means that actually they mean something. These are all extremely common experiences with everybody. And I did one PhD course, PhD in DAS syndrome, community issues and all of that. Maybe the possible number of stories what I have heard, maybe about 1,000 plus I can actually comfortably place it. Each and everyone has their own way of presentation. One of the most important things is actually they are hesitating to go, they want to talk, and all means there is possibly something related to sex they want to tell. My problem with the life means is actually sexual problem. And many young ladies come and tell, in fact, not only young ladies, middle-aged and all of that, multiple somatic complaints, aches, pains, and they want attention, they want invasive procedures, they want emphasis on psychological issues, they don't want to emphasize on psychological issues. My immediate conclusion is actually that this particular lady is not serviced properly. No, you got the point. That is one of the area, if you keep it in mind, you'll realize that a little old issue will come out and a whole lot of things you'll realize these people are actually having problem in this particular area. We are psychiatrists, and when we go and talk to quite a few people here, there, and all of that, how to explain anxiety, how to explain stress. Stress means, many of you might have given stress management classes and all of that. Is a very easy topic, it looks like that. Instead of using hundreds of words, sometimes I make use of some common this thing. Are you married? Okay. Stress is equal to when you get the news that your wife is pregnant. Oh, you got the point? What happens? Another about 9-10 months, 11-12 months, she is not available to you. They feel little nervous. That little pressure. That is actually called stress. Anxiety is when your girlfriend is pregnant. This is a little more than what we actually basically expect. A little nervousness and other related things, all the things will be little at a higher level. Panic means very easy to explain. Maybe something like very acute anxiety. See, your wife is pregnant, your girlfriend is pregnant. Your girlfriend says, I am pregnant, you come home and your wife says, I am pregnant. Now you got the point? Depression or tragedy, when you have not done anything but these two are pregnant. You got the point? It's very easy to make out. The whole psychiatry can be explained in such few beautiful terms, make people to make understand it is very, very easy. Of course, this is one of the things, evaluation. Many people do many things. Very recently, one villager, in fact, this particular fellow wearing some lungi and very haggard looking and all that. He came and told that I've been evaluated. How? He's supposed to have gone to his classmate, many years old, and he went and told, my wife is scolding me, but I am not able to perform. Then she told, I believe, come, let's try, and if it works, you can go back. See, evaluation, how precisely. And the same story, even with certain babas and other things, potency test. What I heard is, people trying to bring the prostitutes, trying to stimulate him, and if it works, he is actually involved in that sexual abuse. Otherwise, these are all certain things very commonly we come across. And in psychiatry, we have something called as personality issues. Particularly, in fact, some of you young girls who are not yet married and you want to marry means you will search for a nice boy. You got the point? My experience is nice boys are the worst husbands. And you got the point? Very good lineage, very nicely brought out. I still remember one young patient couple was referred to me. They were from somewhere around nearby native place. This fellow, sir, I am not able to perform. When we went into the details, wife gave me a little extra information that, sir, this fellow doesn't want me to close the door. Why? Sir, my parents have brought me with so much of love and affection and all of that. If I just close the door, what they will think? The whole treatment was actually just close the door. Actually, things work so well. And very recently, in fact, it was almost going to the divorce, just about 6 to 8 months back. Married here, but went to USA and they are there and a whole lot of difficulties. This fellow is a little obsessive fellow, and nice, everything neat, clean and all of that. She is a little casual. Casual means nothing abnormal in that, but one example what he was giving, why he flared up so badly. The pillow which was supposed to be near the head, one pillow was near the foot end of the bed. In fact, 3 days he has observed and he was boiling himself within that she has not kept the pillow in the proper place. And on the third day, you are there at home only and you don't keep house clean and what bad this thing and all of that, he has scolded her so badly. Many of the times, just I had another couple wherein It had went to almost to the divorce level because she is fond of squeezing that toothpaste tube in the middle of the tube. This fellow wants tube has to be squeezed from the beginning. What? The whole issue. See, sex is one, whichever end you make use of, everything is operable actually. See, there was some lady who was coming and telling, my back entry is a problem. See, back entry is exit entry. Which is entry and which is our exit. Many times people get confused and that's why actually they land up with a whole lot of difficulties. One of the medical students, she told, sir, I did a mistake because she got married to the one senior batchmate. I did a mistake. What mistake? Then she was narrating the whole story. Sir, I met this fellow in the library. This fellow used to come to library. He used to sit and read. Of course, library is meant for sitting and reading. What is the problem? Sir, he never used to look at girls and sit and read. See, that is the problem. If a boy is not looking at other girls, not worth marrying this fellow. No, you got the point? Those who are married, there is no choice. Anybody who is little naughty, in fact, only those type of fellows can add a little bit of spice. So this is one of the very important lesson what we have understood. And when we come to what we basically call men and women, these are all extremely common problem. And see, if I had realized after marriage this is the amount of difficulty to manage wife means I would not have married most probably. No, you got the point. She takes care of everything, that is fine, different issue. Somebody was telling women they goes to different phases, that is true. Sometimes she behaves like girlfriend, sometimes she behaves like wife, sometimes she behaves like mother-in-law. Now you got the point? Sometimes she behaves like mother. Time to time their personality changes so much that we have to adjust to that particular situation. Many of the times, what I have realized is actually when they tell something, we have to just nod and approve it actually. Once we give suggestion, that's where the problem comes. What I have realized. This is a lesson learned for quite some time later actually, in the sense that you give, because she is definitely more intelligent than you. This much anyone of us will agree with that. So don't try to give your solutions which are not actually of good quality. This is one important. And this is because our brain. See, man's brain is like desktop. Woman's brain is like a laptop. You know that? Women are like laptop. Women are laptop only, isn't it? So even brain is also that particular fashion. Men's brain is bigger, almost 150, 200 ml, big size, low capacity, wrong connections. That is the man's brain. Women's brain, small one, well organized, high capacity, very beautifully connected. The whole difficulty comes, we are actually almost all the time we are thinking about sex, directly, indirectly. And there is actually theory that every 5 minutes, at least once a man thinks about sex. Now you got the point? The story about women is actually something totally different. And when you try to look at, apart from the size, we can't multitask. This is one of the area where they can do a lot of things, and many women come and tell that this particular fellow is totally useless and all that. I always tell them, because of the experience what I have, that you have to be little careful about what you are telling. See, men are handicapped fellows. We need to be given disability certificate from the beginning itself. So from the birth itself, all men born should be given a disability certificate. Why? Our hearing capacity is about 30% less than women's capacity. If you tell 10 things, only about 2 or 3 must have gone inside my head. When I look at it, actually, that girl who is sitting in the last row, who is not married and wearing that deep cut blouse, I can make out very easily. But the whole somebody is putting the bomb underneath me, actually I won't be able to understand. Left-right orientation is very poor in case of men. But you women can do a lot of things which are extraordinary. In fact, women's gaze is actually something like very sweeping. Who are all married, who are good fellows, who are would make a good husband. Every calculation she will finish up in about few seconds time, whole calculation. Whereas that nice looking girl there, size of certain things, everything actually. In fact, we men are actually have that particular idea that we believe that women have eyes on their chest rather than on the face. These are the few of the things, weaknesses you call or strength what you call, but actually that's the way it works. So when you are trying to talk about multitasking, don't get upset with the man. This is what actually I always say. You want 1 kg rice, you tell him 1 kg rice, he will bring it 10 kg. You want one bunch of coriander leaves, you tell him 1 bunch of coriander leaves, he will bring. You want another item, don't tell him 1 kg rice, coriander plus other one, 3 things, confused. No, you got the point. One at a time. Our mind is actually in such a way that only one at a time what we actually can work on. If you were to add too many things, actually we get into what we call confusion. And that too, you might have told him about 3 things, and when we actually go out, I came across another nice, beautiful looking girl in front of me, miss, even those 3 things, even one item also you forget. Write it down and give, instead of talking, because he's hearing. See, if you understand that this fellow is a handicapped fellow, all problem will get solved. The first point what you have to understand is actually, you want to be absolutely happy in your life, women have to marry women. Men have to be absolutely happy in their life, men have to marry men. Men cannot marry women and women cannot marry men and then want to be happy. Not possible. There are actually invariably bound to be bunch of issues. So these are a few of the extremely common things. Of course, we come across a lot of cases, ED, this one, PE and all of that. Very recently, sometime back, almost not recently, means about 1 or 2 years old story I am telling. One fellow came and told me, sir, my wife asked me to have sex in the kitchen. And suddenly, that's good. In fact, we people cannot have too many. We had one class, this in colleague, he built the house, the 5 bedrooms. One bedroom is labeled as Monday, another one as Tuesday, and another one as Wednesday. Everybody can't have. In Pune, Mumbai and all, like how many bedrooms you can have in your house? Difficult actually, isn't it? So, she called me for sex in the kitchen. He's supposed to have gone and performed, and then a little while later suddenly got confusion. I am married for almost so many years, but first time she called me like this, what is the problem? Then he couldn't control his anxiety and then asked her, what is the reason you have called me like this? Her explanation was that pressure cooker visual is not working. Anyway, you won't last more than 1 minute. Now, to set the timer, she had called him, let us have sex. See how actually sometimes we won't even realize that a whole lot of things can go that particular way. Of course, coming to there, a lot of other things are there one can speak on. The important point is actually anything and everything what you come across, once you are used to looking at the sex, a lot of things happen, and see, there are few things in life which we cannot control. One example I tell you, my co-brother, what we call now, is this fellow was having a lot of problem in the office. He wanted to transfer, he was working in the bank, to a different branch. Struggled, brought some influence and paid some money also, and ultimately he was transferred to another branch which is about 10 kilometers away. Second day, the same manager with whom we had difficulty in the earlier branch, he was also transferred to the same branch. Can you imagine? So once we are married means it is there, it is the package that comes. You have to manage with that, what is available, and she has to manage with what is actually available. And when we try to go out of our way to actually modify the situation, most likely we'll land up with difficulty. I tell you, my classmate was there. I treated his sister for bipolar disorder, mania, excitement. Then mother also developed similar problems, somewhere was around 50 plus, brought and treated. So this fellow is a little educated fellow, that what I'm telling is actually a long back story, 45 years old story. So he decided, I don't marry anybody who is having mental illness in the family. went on collecting information. Every proposal comes, he will put up few people to know how many minutes are there? 5 minutes. Okay. You put up some people to know whether actually somebody is having problems, this, that, anything related to psychiatry. A little while later, his marriage invitation was there. I was not able to go, and I was already there in Mysore. One day morning, he suddenly comes in the morning by 6 o'clock and knocks my door. You are such a bad fellow, this, that, and all of that. Ultimately, what I got the information was, he got married to a girl lady, thinking that there was no family history and all of that, but the same girl was treated by me for depression. So, what I am trying to tell you, nothing you can do. So it is a package that comes and one actually has to manage. Of course, coming to the treatment and all of that, I always talk about relationship. Giving certain tablets like say sildenafil, PDE5 inhibitors, problems get solved. Yes. And even in the last presentation I was telling, at the end of 2 years, around 2,000 plus couples, hardly anything has changed because as far as the women are concerned, it is actually the emotional satisfaction which matters, and if it is not there, actually they are likely to land up in problem. But that doesn't mean that we have to be extraordinary. Only thing is we have to spend some time with the people. I always say history. One Malayali, the road where I practice, he came and told me a little net survey, sir, I have both ED and PE. Now they are two different things. He tell me, explain a little more. So then his story is, he closes the shop around 7:30, goes to his girlfriend's house, early ejaculation, goes home, dinner, not able to perform. No, you got the point. Story is very simple. Then I told him, let us put the timetable properly. So you will close the shop at 7:30, you will go straight home, you have dinner. He was able to perform. And to girlfriend, while coming in the morning, visit the girlfriend, there was no premature ejaculation. You got the point? So there is not sexology is not a rocket science that you have to do something extraordinary all the time and all that. Very simple, little extra information will tell you what actually we have to do with the individuals. So important point is, we have to be little motivated, enthusiastic, comfortable, relaxed, being sensitive to individuals' issues. Don't get attached to. Many of the times, many of the sexologists not being judgmental, this is one of the things we say, and other important point what we say is actually, don't feel yourself jealous. This fellow is having girlfriend, I don't have girlfriend. You get upset. I got the point. You examine, he is having a penis bigger than yours. You feel so... And everybody comes and says, say for example, even horses, donkeys have such big things, why we are actually having such small things? So, many of these type of things, all the time, consistently, they will be actually disordering you to a great extent. Be comfortable and cool, and ultimately, the barrel of the gun doesn't matter. How actually the piston works. So, that is the important message.
So that Sari, your wife.
Of course. Of course. Let me tell you, somebody has gone and told, this is the story I have told in the class. Now you got the point. After that I had a big class and all that. So I am telling now that this is the story of somebody else. Now you got the point. This is not my story. The important point is, I got married almost around 36 years back. My wife was complaining that this Muhurtam saree what I have given is of not good quality. 3 months later she was telling that Muhurtam saree what you gave, no, it was not of good quality. 1 year later she was telling that Muhurtam saree what you gave, it was not of good quality. 3 years later, even today my relatives talk about this particular saree, that Muhurtam saree what you gave, that yellow color saree, it was not of good quality. 10 years later she was telling, even that Muhurtam saree, even today I get sometimes in the dreams. And my relatives, whenever we meet, actually they tell about this. About 5 or 6 years back, she was giving off some of the old sarees to the ashram. And I was very happy that that memory, old memory has gone off.
That's all.
Sometime later when I open the Almirah, the saree is still there. Hey, all the sarees you gave up, why this particular saree? Her comment was to remind you. The story is they don't forget. They don't allow you to forget. The whole story is this particular. So whatever you speak, whatever you do, you have to be little careful. This is one. Of course, the last one I'll tell you. We are all, you ladies sometimes put lot of rules and regulations that we should not look at other ladies, this, that and all that. This is extremely common. Of course, you may not be that way, but today while coming to the program also, not today, 3 days back she told me, don't look at ladies and talk. No, you got the point. That's what she says. One of my senior batchmate and another senior fellow coming telling her, see, your husband was watching girls on the road. Her comment was very simple. More hungry, that much better. You got the point? A little change in attitude makes wonderful things. I am actually watching this Ajit Chakravarti's wife. Beautiful. Look at the copy how these people are actually like. She is allowing everybody to stand next to Ajit Chakravarti and making him as hungry as possible.
Thank you for